is up everyone and welcome back to my channel. It has been a long time coming and today we are back discussing about the back and autonomic nervous system. Now this is a long topic, so this topic will be divided into series of multiple videos, and in this topic we will be discussing the anatomy of vertebral column and the spinal nerve. Then we will also be discussing about the somatic and autonomic nervous system and the difference between them, while we will also be discussing about the difference between the parasympathetic and the sympathetic nervous system. So in this video, the first part what we are discussing is the vertebral column. We are also discussing about the intervertebral disc, the spinal nerve, while also discussing about the topics like the lumbar puncture and the compression of the spinal nerve. So get your snacks ready and let's begin. Alright, so the first topic we will be discussing is the vertebral column, or mainly the vertebra. As you can see on the screen, we have mainly 32 to 33 vertebra in total. They are divided into certain parts. The first C1 to C7 are cervical vertebra, while we have 12 thoracic vertebra from T1 to T12. After the thoracic vertebra, we are down to lumbar vertebra. We have 5 of them: L1, L2, L3, L4 and L5. After the lumbar vertebra, we have the sacrum, S1 to 5. They are fused, note that. And after that we also have 3 to 4 coccyx. That's why we say we have 32 to 33 vertebra in total. Now also a point to note is that we have 31 spinal nerves. We have 33 vertebrae, however the spinal nerves we only have 31. Each spinal nerve is between 2 vertebrae. So C1 and C2 would have the first C spinal nerve, and then C2 to C3 will have the second, and so forth. Another interesting thing to notice is, first and foremost, if we just take a look, the anterior view, if you look at the spinal cord or the vertebra from the anterior view, you would be able to see the intervertebral disc. However, if you look at from the posterior view, you should be able to take a look at the spinal cord. So let's begin. Alright, let's focus on the anterior view. The main function of our spinal or the vertebra is to take the weight of the body and help support all the weight. Now, if you notice, as we go from C1 all the way down to L5, you should notice that the width of the vertebra is increasing. Why is that? The main reason for that is, as you go down, you are bearing more and more weight. So if you go from C1, you see the vertebra is relatively thinner compared to L5, which is much thicker and much girthier, because the weight L5 is supporting is way more than C1. This is what we call load bearing, and that is another reason why the vertebra expands as we go down from C1 to L5. Now, if you notice, after L5 sacrum, it is decreasing in size again. But why? The main reason for that is, once you reach L5, after that the weight is distributed to your hind legs. So after L5, the weight will be going to your legs, and that is why the sacrum, as you see fused, is not as wide and is decreasing in the width. Now, because the lumbar is bearing the most amount of weight in your spinal cord, the most injury prone area would be, of course, the lumbar, and we will be discussing that later. Now let's talk about the spinal nerve. The spinal nerve is present inside the vertebral column, and they branch out. Not only are they in the middle of this vertebra, it also protects the spinal nerve, but they also branch out at each possible vertebra. So where do they branch out from? If you see on the lateral view, the intervertebral foramen. So every spinal nerve, they branch out from the intervertebral foramen. And if you take a look at the posterior view, there is not that much space between the cervical vertebrae, but if you go down to lumbar, you will see that there are interlaminar space or interlumbral space. This is important because why? If you were to perform a lumbar puncture, you would not be able to do it at the cervical or the thoracic section. You need the needle to go somewhere, and for that you need a space, and hence why, because of the space in the lumbar section, we are able to do the lumbar puncture. Now, how will you manage to find that space? The usual place to do a lumbar puncture is between L4 to L5, but how are you going to find that particular space? How will you recognize the lumbar L4 landmark? So the process to do that is the top of your iliac crest. How? Let me show you. If I can zoom in, if you take a look at the left side, this is the iliac crest of, if you go from left to right, if you just trace the line between the left iliac crest to the right iliac crest, you will find the L4 spinous process. It is in between your iliac crest. All you have to do is just feel your way around and you should be able to find the L4 spinous process. Once you find that, the L4 vertebra, you can just trace the distance or the gap between the L4 and the L5 vertebra, and that is your point for lumbar puncture. Now, let's talk about the clinical correlate, lumbar puncture. Why do we do the lumbar puncture? First and foremost, lumbar puncture is performed for multiple reasons. If you need to relieve the brain pressure, the cranium pressure, or if you need to collect the spinal fluid for the diagnosis of meningitis. It is also used for subarachnoid hemorrhages. To perform a lumbar puncture, you need to pass a needle through the interlaminar space in the midline. Vertebral column needs to be flexed. Why? Because you want as much as space possible in order to pass the needle for your lumbar puncture. You do not want to injure, or you do not want to have your needle stuck in any one of the vertebra, and hence why we put the patient in a position where they flex and the space between the L4 and L5 is maximum in that position. But you also need to take into account where your spinal cord is, and also where your, if you can take a look in this image, where your arachnoid process ends. Why? Because the main reason to do a lumbar puncture is if you were collecting spinal fluid. If you want to do that, you also need to make sure that you are not damaging your spinal cord. But also you need to make sure the arachnoid process is there, because that what contains the spinal fluid. So the spinal cord, usually spinal nerve, or should I say the spinal nerve, ends at the level of L1 and L2. Usually it does differentiate from person to person, so what you need to do is have your needle preferably under L2. So that's why we do it, the lumbar puncture, either between L3 and L4 or L4 and L5. But if you take a look at the previous image, the gap here is even bigger. But why don't we do it between L5, which is lumbar 5, and sacrum 1, S1? The reason for that is also in some adults, the arachnoid process ends at S2 or S3. So you need to make sure that your lumbar puncture is performed between L2 and S2. Now, we need to pass multiple layers in order to perform that lumbar puncture. What are those layers? If you take a look at this image, the first and foremost layer is of course your skin. Now, what's present under the skin would be your subcutaneous layer or your fat layer. Under the fat are your muscles. So if you pass your needle through the spine or through between L3 and L4 as shown in the image, the first point of contact is the skin, and then the subcutaneous and the muscular layer. Now a point to be mentioned is muscle is the one that you will face the most resistance with. After you're done passing the muscle layer, you will be faced with the interspinous ligament, then ligament flavum, and after that you are into the epidural phase. Here, the epidural phase. Now, after that, you will have your dura mater and arachnoid, and once you pass through that, you will face the subarachnoid space where the I'm sorry, where the CSF is present. That's where you need your needle in order to perform a successful lumbar puncture. Now, as we were discussing earlier, the reason we do lumbar puncture not only for the diagnosis of meningitis but also to relieve cranial pressure, but in also cases of subarachnoid hemorrhage. What is that? Hemorrhage basically is the inclusion of blood inside. So the blood is bleeding through and it is pressing against your brain. You do have to realize the CSF is not only in your spinal cord but is also present in your brain. So when you have a subarachnoid hemorrhage, it will press against your brain, and in order to drain that excess blood, you will need to perform a lumbar puncture. As you can see in this image, a subarachnoid hemorrhage, if you see in section C, this line, once you trace this line, that is the presence of blood in your subarachnoid space. So in cases like that, you are required to do a lumbar puncture and drain the excess fluid or the excess blood. I hope that we are clear on this topic so far. If you have any questions relating the topic, feel free to just type them in the comment and I'll try my best to answer those questions for you. But let's move on to the next topic, that is the intervertebral disc. If you can see in this image, each intervertebral foramen contains one spinal nerve on both sides. As mentioned before, every single intervertebral foramen, let me go back to the original image. Where is the intervertebral foramen? Here. Every single intervertebral foramen will have one spinal nerve from each side. So one nerve, and then is divided on each both sides. So now that we know that the spinal nerve is in the intervertebral foramen, it is safe to assume that that is a place of injury. We have a nerve there, and that's where the nerve will get injured. So let's take a look at that. Why or how can that nerve be injured? So the main reason for that would be because of the boundaries. This is our intervertebral foramen. You see this space, this is where you will have your nerves, and for that it will be injured because of the either anterior wall of the intervertebral foramen or the posterior wall. Now we need to take a look on both the sides and determine how or why will we have an injury. So let's take a look at the anterior wall first. Intervertebral disc, if you can see this, the blue part, intervertebral disc, this plays a big role in the damaging of your spinal nerves. How? Why? This is part of your anterior wall of your intervertebral foramen. Foramen basically means the gap or the hole. So the anterior wall of this composes of intervertebral disc, and because of this we will face an injury of our spinal nerve. So if you can take a look at this left side of the image, you see here, this is our intervertebral disc. These are the sections. We have annulus fibrosus, which is the fibrous part of our intervertebral disc, and the main aspect is the nucleus pulposus. Now, nucleus pulposus, this has been derived from the notochord. This is from our previous videos. If you don't know, then this is from embryology. This nucleus pulposus is derived from the notochord, and if you see this nucleus pulposus, it is not exactly in the middle. The annulus fibrosus, it is weaker on this side, but it is more on the ventral side, which is the anterior side. Why? This is because of this right here, anterior longitudinal ligament, or ALL. Why it's important? Because the intervertebral disc most of the times will herniate posteriorly to the lateral sides. It will not go anteriorly because of the ALL, or anterior longitudinal ligament. Now, why will it always herniate posteriorly to the side? The nucleus pulposus, if you see this ALL compared to the posterior longitudinal ligament, if you see here, this is way more thick and sturdy compared to the posterior side. And nucleus pulposus, if it were to herniate, not only will it herniate on the dorsal side but also on the lateral side. So annulus fibrosus, it will herniate nucleus pulposus, it will herniate towards the back and the sides. Now we have already determined what is on the side. Once you take a look at here, intervertebral foramen, the anterior side is where your spinal nerves are, but from the, if you are taking a look at the anterior side, if the disc were to herniate posterior and on the lateral side, it will press against your spinal nerve. Now, if there's not enough compression, then you will not face any effects or you won't know what's happening. But if there is enough herniation and if it presses against the spinal nerve enough, you will have symptoms like muscle pain, the dermatomes resulting in pain, but also because you're pressing against the nerves that are innervating the muscles, you will also feel muscle weaknesses. So if the injury is from the anterior side of the intervertebral foramen, it will be because of the intervertebral disc. But what happens if it's from the posterior side? Anterior side is the most in most cases, but let's take a look at the posterior wall. What happens in the posterior wall of the intervertebral foramen? Now, this wall is mainly made of articulate process. Where is that? Let me show you in the next image. Here, if you can take a look here, this is our intervertebral disc, but if you take a look at the posterior side, we have articular process. This foramen is made by the inferior articular process of the vertebra above and the superior articular process of the vertebra below. So both of these processes are joined by a facet joint. What's the name of this facet joint? Let me go back. If you can take a look at here, it is called zygapophyseal joint. I probably butchered that name. Let me try that again. Zygapophyseal joint. So what happens with this joint? This is a synovial joint and it is prone to arthritis. Now, this joint can also develop osteophytes. What is that? Let me show you again. Osteophytes. You see, this inferior articular process and superior articular process comprises and they make the posterior wall of your foramen. And if you can take a look, this bone spur, which is an osteophyte, is a bone spur. A bone spur is basically a bone growing on a bone. So if you take a look, the superior articulate process, inferior articular process, if they have osteophytes, they will result in nerve compression, nerve innervating. You will again feel pain and muscle weaknesses. Now, there is very important rule when we are talking about the herniation of the disc and compression of the nerve. When herniation occurs, the nerve will compress, but which herniation, which intervertebral disc will compress which nerve? Let's take a look at that. If you can see in this image, when a disc herniates, it will not compress the nerve of that said vertebra. So let's take a look. If the intervertebral disc of L4, if the L4 vertebral disc is herniating, it will not compress the L4 lumbar spinal nerve. Important point to note here, it will compress the nerve below. Why? When a disc herniates, it will always herniate downwards. So when the disc is herniating, let's say in this image L4 disc, it is herniating, it will not herniate and compress the L4 lumbar spinal nerve, but rather it will compress the fifth lumbar spinal nerve. So that is important. It could be used in a question when you have a herniation of L4, it will compress the nerve below, which is L5. So important rule you need to remember. But that is our intervertebral disc, and that is our herniation of, and also the posterior and anterior walls of the foramen. In the next video, we will be discussing the differences between somatic and the autonomous nervous system, and also we will be discussing the differences between the sympathetic and the parasympathetic nerve. But I hope this video has been helpful to you guys. If you have any questions, like I said, do feel free to mention them in the comments below, and I will try my best to help you answer that question. But again, this has been me. I will see you guys for the next video. Take care and goodbye.